This next question, we'll start with Mr. Apple. We've touched on it a little bit tonight, but what can the legislature do to make affordable quality health care available, accessible to every Washington resident? And explain what options you might consider. Mr. Apple.
One of the things our state had and really needs to be protected is catastrophic medical care. And that's care where, for unknown reasons or who knows, somebody gets sick in a family and the costs overwhelm the family. The family pays a horrible price almost always when that occurs. We need to make sure that we have catastrophic medical. And I think the state was on the right course with medical care in our state prior to the national program that's now being reviewed. The Supreme Court will be ruling on shortly. And I think the state had a better plan. To be honest with you, I think the state was in the right direction of actually providing better medical care to everybody. And I would like to see a single-payer system because I don't think we can involve everybody and make medical work in America today. It's just too big. But I think that the state has got a lot to work on, and we also have to deal with what will occur, won't occur with the national medical plan. So a lot's in the air, and I guess until we know where things are going to come down, we won't know what we can do to make things better.
Okay, thank you. Mr. Benn.
As a state, we have created more medical mandates and healthcare mandates than most other states. Our costs are very high for healthcare insurance because of the amount of mandates that we have. Many of the mandates do not protect the people needing healthcare, nor do they have any issues that are going to be covered for that individual. Sometimes people are paying for coverage that would never apply to them. So we need to address the cost of healthcare insurance in our state. Currently, we only have 4 or so insurance companies in our state, while others have 20 to pick from. And that competition has also helped lower the cost of healthcare for union workers, for teachers, private businesses, large companies, small companies, and independent business owners. So I think we need to address the medical mandates that we've created in this state to be competitive so that people stay in this state and get their health care here. I've seen a number of doctors leave this state because of the mandates that we have here.
Okay, thank you. Mr. Oyler.
Yes, well, Bob touched on a very good point that whatever the Supreme Court decides in the next few weeks will really change the game, and we don't know where we can go until we know what the federal law is. A couple things we can do is support preventive care, teach people to be healthier, then that reduces the need for health care, treat people as individuals. So some people, a health savings account would be a good idea, catastrophic care would be a good idea, and opening the system up to competition, allowing individuals and companies to purchase insurance nationally in a national marketplace across state lines would reduce the costs immediately. Earlier it was mentioned about the reform that was put in place about 20 years ago. When that was put into place, there were 19 or 20 insurance companies in Washington. Today there are like 3 or 4. So putting more mandates, putting more expectations on providers reduces the quality and reduces the availability.
Okay. Mr. Riccelli.
I believe every individual has the right to affordable health care. Affordable and accessible health care, and we need to expand the basic health program, not be drawing it back. And folks can say, well, that costs money, but you know what costs more money? Our increase in premiums when those folks use the emergency rooms and use them for sniffles, and we can be more effective. There's some new effective models, too, if we want to talk about innovation. We also, on the west side, they're looking at a gym membership type company where you pay a flat fee and you can see your primary care doc as many times as possible. I absolutely agree with Morgan that we need to look at wellness as a model as well. We're not just treating people for their illnesses, we're trying to keep them healthier. But we do need to expand basic health. Senator Brown fought hard, and I was happy to support her in her work to not have it clawed back even more. A good number of people use basic health in the 3rd District, and it's a vital program that keeps folks out of a further drain to our tax system.
Okay, thank you. Mr. Snyder.
So this covers just about every aspect you can think of in government these days. I was doorbelling the other day, and I talked to a woman who was a retired teacher who both her kids were also teachers, and they're having a hard time finding a job. And one of the reasons she thinks it is because there's a lot of teachers that are older that are hanging on to their jobs because as soon as they quit, they're not going to have the health care that they have now. At the city, we have two different programs just to divert people from emergency rooms and emergency services to cost the city less money. The fire department runs one, and then we also fund one out of human services. When we don't have health care, we pay for it at the emergency room. We need to restore folks to basic health because if we don't, it's just deficit human spending. Later on, we're going to pay for it one way or the other. We have to keep the most popular parts of the Affordable Care Act. If we don't, the insurance commissioner just showed that about 70,000 people in Spokane County will be at reduced benefits if that gets struck down. So we need to work to keep those provisions in place.